A heel pain is commonly seen with pain on the bottom of the foot. Usually it's worse in the morning when they get up. The most common diagnosis with that is plantar fasciitis. There's a small subgroup of patients that can have a nerve being pinched. There's also patients could have had a history of trauma, a broken heel, or a bad sprain that could persist their heel pain. You'll also see it with people who are starting a new exercise program where they're overworking the bones and the soft tissue structures around the area. With kids, it's a lot of jumping sports. They're picking up that skateboard for the first time, or they're doing some new gymnastic training, karate, something of that sort that'll inflame their heel. With adults, most commonly it's plantar fasciitis. We see a lot of athletes in our practice, triathlons, marathoners, and they're basically pushing their bodies, demanding the most from their foot and ankle and their mechanics. And sometimes it's too much and they'll get the plantar fasciitis or other heel pain. They can even get a stress fracture. So there can be other issues besides soft tissues. Very occasionally I've seen a tumor, so we like to do an x-ray to rule out something of that sort, but that's obviously very uncommon. But there's most common things is plantar fasciitis, apophysitis in children, which is the growth plate that's inflamed. But there's the occasional patient where there'll be something more going on that we just need to look at. So you really, there's a lot of emphasis or interest in heel pain in the community, but it really serves yourself to see come into our practice to be evaluated. Let us rule out some of these other things, make sure we know what we're treating. I like to even use an ultrasound examination to really look at that plantar fascia. I can measure it, compare it to the other side. Or if both sides are involved, we can look at both sides, and then we can develop a treatment program what's appropriate for you.